Watch Dr. Drew's new show at 9 on HLN. Weeknights on HLN.
What people seem to just neglect, and I say this respectfully, Michael Jackson was addicted to propofol, first and foremost, beyond anything else. He was addicted to propofol, and my client has made multiple interventions in the past related to propofol. You know,
on Michael.
Oh yes, on propofol issue, and it's there. I am not at liberty to get into greater detail as far as his treatment, which is what frustrated me yesterday, because of the HIPAA and all the other, except to the 4 months of medical records that are put out there. The medical records, I think you would agree, are a short memorialization of what occurred there. I think if you were to write down word for word for the 3 hours a patient is there, you probably have to write a novel for each.
Well, in internal
entry.
medicine, you have to write pages because Medicare reviews every word, and you've got to have lengthy documentation of everything that goes on. That's internal medicine. I know what dermatology
internal medicine,
is all about.
Well, I don't know about internal medicine or dermatology, but I do know that Dr. Murray is an internist. And where are his medical records?
Egregious. And by the way, it's more of that special care that, I was just there all the time. Why do I need records? I'm taking special care of my patient. You and I agree that Murray's care was outlandish, yes?
Well, it was outlandish, and that's why he's on trial. You do know that the DEA looked at my client extensively. The DA's office looked at my client. The LAPD looked at my client.
Why, if things are so...
They looked at all the other doctors. You're an intelligent man.
Yes.
There must be a reason why he's not being prosecuted, isn't there?
Yes. Yeah. Why? There must be a reason they looked at him, though.
Well, they looked at all the doctors. What do you think I do when I take on a case? I look at all the players, all the audience, everybody on the sideline, everybody on the field.
Yep.
You have to. You do your due diligence.
Yep.
So, I've done some looking into the last 2 years about who is my client, and I've said yesterday on some show, I don't think it was yours, that he had done 2-year fellowship, research, and co-authored a book on addiction. He had interviewed hundreds of them, and he is on record. If you go look him up, you will see he's on record that he is anti, and he's an FDA advisor now, and he is extremely anti this stuff.
Here is his list of Demerol exposures from March to April.
But let's talk
if this
about
had been
that.
any of my patients, if they'd gotten this far, he should have airlifted him to me.
You said that to me yesterday.
You're in big trouble here.
You said that to me yesterday.
Yep.
But because of your expertise in addiction medicine, would you not agree that someone who has a higher tolerance for medication needs to be given a higher dose? Now, let's addiction aside. Addiction, for a second. Addiction aside.
Yes, categorically.
Okay.
And even with addiction, I would say categorically the case.
Okay. So then at that point...
Let me tell you, the things that I hate is when I get a heroin addict with a needle embedded in his arm who's in excruciating pain and the surgeons go, hey, he wants opiates. Who are we to give... I mean, guy's in pain. Give him drugs. Are you interested in getting off your heroin? No. Give him the Demerol. Fine. Now, Michael may have they may have had that conversation. Michael may have said, you know what, Doc? I'm an addict. Just control my pain and fix my face. That may have been the conversation.
I could tell you that was not the conversation.
Okay.
I could tell you that was not the conversation.
That would have been fine with me, by the way. Because the patient doesn't want to do anything with his addiction. He wants his pain controlled. Fantastic. Do it then.
Well, but that was not the conversation.
Well, then he should have called an addiction medicine person. Where are the psychiatrists and the addiction medicine people in this? But
no, Dr. Drew, again, respectfully.
Yes, sir.
If you are going to take it as a given that this man is addicted to Demerol, which is what the defense on Conrad Murray, in the Conrad Murray trial...
I'm not sure that's true. I'm not sure that's true.
Okay, I'm not sure it's... I know it's not true.
But he was exposed to opiates.
Let's just say, well, certainly he was exposed.
Yeah.
But to suggest that he had a dependency of a recurring nature, Dr. Klein would have to inject him every 4 to 6 hours.
No, but you're making my case for me. You did the same thing yesterday, which is I'm firmly of the opinion. So look, insomnia is like saying fever. It's a symptom.
Right.
It's not a diagnosis, really, though. I mean, unless you ruled everything out.
But does the dermatologist know you have insomnia when you're there at midday for a treatment?
No, but my point is,
that.
I made this point all along, which is that Dr. Murray was treating drug withdrawal, not insomnia. And you could see every time he'd give him withdrawal medications, he'd get better. And then he took him from propofol, which does suppress a lot of withdrawal symptoms. My patients, when they overdose, end up in the ICU on propofol and a breathing machine, their withdrawal's smooth.
Well,
on
you're
the
putting
propofol.
him out, obviously.
I'm just saying.
Right.
But so propofol is suppressing the withdrawal. Then he tries to get him up the propofol, and the withdrawal from the propofol and the Klonopin, which your guy gave him too, the Klonopin and the other benzodiazepines and the Restoril, which he was getting Restoril, Valium, Klonopin, Midazolam, Ativan, and he withdrew from all that too. So it's the multiplicity of medicines.
But
here
the benzodiazepine, don't you agree with me? It's worse. It's worse. It doesn't treat the withdrawal. It masks it. It doesn't bring you out and makes you all fine and well.
You're right. In a way, you're right. That's a complicated point. But yes, you're right. And the fact is that he was having withdrawal from all that stuff too. And so my point is.
But all that stuff is not on my client's watch.
Right. And that's where you and I have absolute agreement that there was egregious exposure, and Murray was the guy at the center of the hurricane. You know, he knew what was going on, and he chose. It's in this report. This report right here is his interrogation with Dr. Murray, and he says, well, I knew he was seeing Dr. Klein, he was getting a lot of meds, and he was seeing Dr. Metzger and getting a lot of meds, but Michael wanted to be private about that. What am I supposed to do? What are you supposed to do? That's what a primary care doctor does. Well, a cardiologist doesn't know how to be a primary care doctor. Why do you
think Dr. Klein is furious with Dr. Murray? Because he didn't know his existence.